Hello friends, welcome back to our channel Longani Clinics. Today we are going to explore one of the most fascinating and highly practical clinical repertoire in homeopathy, that is Bell's repertoire of diarrhea. Although it is not discussed as frequently as Kent or Bonigason, but this repertoire remains a valuable tool for every homeopathic practitioner who deals with diarrheal disorders. Diarrhea is one of the most common complaints encountered in daily clinical practice. However, selecting the most appropriate homeopathic remedy can be often become challenging because many remedies share similar symptoms. To make this task easier, several specialized clinical repertoires were developed. Among them, Bell's repertoire of diarrhea occupies a unique and respected place. This repertoire was compiled by Dr. James B. Bell, an American homeopathic physician born on February 21, 1838. He graduated from the Homeopathic Medical College of Pennsylvania in 1859 and later became the president of the International Hahnemannian Association in 1892. Although very little personal information about Dr. Bell is available today, his contribution through this specialized repertoire continues to benefit homeopathic practitioners around the globe. The complete title of this work is quite extensive: The Homeopathic Therapeutics of Diarrhea, Dysentery, Cholera, Cholera morbus, Cholera infantum, and all other loose evacuation of the bowels. This title itself reveals the author's intention to create a practical guide for every type of diarrheal condition. The first edition appeared in 1869. Over the years, the repertoire underwent several revisions and improvements, with important editions published in 1881, 1888 and 1896. In fact, the 13th editions have been published, reflecting the continued usefulness and popularity of this work. Dr. Bell described this repertoire as a labor saver, developed from nearly 10 years of clinical experience. With each new edition, additional remedies were included. The repertoire was revised and remolded, and only those medicines possessing clear and distinguishing symptoms were retained. This selective approach helped to maintain the practical value of the repertoire. The book is divided into two main sections. The first part contains 141 remedies along with their characteristic indication. The second part consists of the repertoire proper, where symptoms are arranged systematically for easy reference. One interesting feature is the grading of the remedies. Bell used 4 levels of importance. The most characteristic remedies appear in bold type, followed by italic type, then ordinary Roman type, and finally remedies enclosed within brackets. This grading helps the physician quickly identify the relative importance of each medicine. In the therapeutic section, every remedy is presented under several headings such as the type of stool, aggravation, amelioration, symptoms before stool, during stool, after stool, then accompanying symptoms and symptoms during convulsions. This arrangement allows the practitioner to obtain a complete clinical picture of the remedy. Now we'll see the one example, that is Podophyllum, one of the most important remedies in diarrheal condition. Bell describes stools that are profuse, watery, offensive and greenish and often involuntary. The symptoms are commonly worse in the morning, at night and during the hot weather. The patient may obtain relief by bending double, applying pressure to the abdomen or keeping warm. Severe colic, prolapse of the rectum, exhaustion and symptoms during dentition are frequently associated. Bell even remarks that no remedy is more surely indicated in painless cholera morbus than the podophyllum. Now let's understand the structure of the repertory itself. The repertory is divided into 5 major sections. The first deals with the pathological conditions such as cholera, dysentery, diarrhea and cholera infantum. The second focuses on the character of stool, including descriptions like watery, green, colorless, tomato sauce like or containing undigested food. The third section covers the modalities, including aggravation, ameliorating factors. The fourth section records symptoms occupying before, during and after stool. Finally, the fifth section presents general accompaniments arranged according to the Hahnemannian schema, covering mind, head, appetite and other systems. Then working a case with Bell's repertory. The physician first identifies pathological condition, then studies the nature of the stool, followed by modalities and concomitants, symptoms before, during and after stool, and finally considers the patient's general symptoms. This systematic method helps to narrow down the most suitable remedy quickly and effectively. The repertory offers several notable advantages. It is concise, practical, easy to use. Concomitant symptoms are grouped together, making analysis simpler. Rubrics are arranged alphabetically. Remedies are graded according to the importance, and the repertory constantly encourages consideration of the patient's overall state rather than focusing solely on the stool. The detailed description of symptoms before, during and after evacuation is another remarkable strength. Of course, like every repertory, it also has limitation. The number of remedies is relatively small because Bell included only medicines that were sufficiently known at that time. Remedy relationships are not discussed, and many remedies discovered or proved later, including bowel nosodes, are naturally absent. Some rubrics also contain only a limited number of medicines. Despite these limitations, Bell's repertory contains many clinically valuable rubrics. For example, diarrhea after bad news points towards the gelsemium. Diarrhea after cabbage suggests petroleum. And diarrhea in fat children directs attention to the calcarea calf. Similarly, ameliorations from cool places may indicate pulsatilla, while relief from cold drinks suggests phosphorus. Among the frequently indicated remedies in this repertory are aloes, argentum nitricum, croton tea, chamomilla, pulsatilla, podophyllum. Each remedy is presented with practical clinical indications that can be readily applied at the bedside. As we conclude, it is important to remember that clinical repertories have often been underutilized in homeopathic practice. However, when their scope and limitations are properly understood, they become extremely valuable tools. Bell's repertory of diarrhea successfully combines clinical practicability with Hahnemannian principles of individualization and totality. More than a century after its publication, it continues to serve as a concise, reliable, and effective guide for managing diarrheal cases. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more discussions on rare and historically important homeopathic repertories. Thank you once again.